Hey everybody, what's up? Chad Wesley Smith here for the Jug Life podcast. This week's guest is Dr. Spencer Nadolsky, board certified physician specializing in lipidology and obesity. He works with Renaissance periodization, helping them improve all of their diet templates and the app. He's a college wrestler. So today we talk with Spencer about some about college wrestling and his journey to his current place in the medical field, things that he would change about the education of doctors and ways that we can better attack the obesity epidemic in the United States. So make sure you subscribe to the podcast, give us a 5-star review on iTunes. You can find it on YouTube, iTunes, Spotify, Stitcher, iHeartRadio, and at jtsstrength.com. Also visit jtsstrength.com for all of our new apparel, online coaching, powerlifting, weightlifting, super total, power building, strongman, juggernaut AI, all that good stuff. So thanks for watching. Make sure to like the video, share it with your friends.
Coming to you from Orange County, California, this is the Jug Life Podcast with Max Ada and Chad Wesley Smith.
So Spencer, thank you so much for taking the time and coming up here.
Yeah, thanks. It wasn't too bad of a drive.
So you're down in San Diego now?
Yep, Pacific Beach.
And where'd you move from?
I came from Maryland. Wife's a Navy doctor. They sent us from the Walter Reed, the President's Hospital, over here to Balboa Naval San Diego.
So life in PB's got to be...
I'm from Michigan,
Yeah.
so I went down to North Carolina for undergrad, which was awesome, and then slowly migrated up Virginia, then also in Maryland. I started getting that kind of Michigan weather, and then they sent us over here, and nothing's like it.
Yeah, not a lot of Michigan type of weather in PB.
Yeah, love it.
So mentioned North Carolina college. You were a wrestler in college. So tell us a little bit about your wrestling career.
Yeah, so my brother, who's 4 years older than I am, amazing high school wrestler. He ended up a 4-time state finalist, 2-time state champ in Michigan. But he was short, and so he was like 100 pounds as a freshman and ended up at 152 as a senior in high school. And he was, you look at a bodybuilder, he looked like a bodybuilder, but was an amazing wrestler. So he went to Michigan State, had an amazing career at Michigan State. Well, I was a little bit taller. So actually my freshman year, everybody thought that I was going to be this amazing, 4-time state finalist, whatever. And I actually didn't even start because I was a taller version and probably hadn't gone through puberty yet, kind of thing. So, but I bulked up. I was like, I just got to be like him, but in a taller frame. So I bulked up, used exercise and nutrition science to kind of build that frame, and ended up a state champ at 215 my junior year. Then did very well, went up to heavyweight, and then actually went to college at Michigan State to play football. Their coach got fired. Long story short, ended up wanting to do both wrestling and football.
Who's the coach then?
Bobby Williams.
Right.
So Saban was the coach. Bobby Williams was his successor. They fired Bobby Williams my first year, brought in this guy who did a spread offense. I was a fullback, and they basically said, go with the linebackers. I'm like, I'm not going to play linebackers. The wrestling coach at Michigan State said, be our heavyweight. So I was like, okay. They gave me a scholarship to wrestle instead. And I have seasonal affective disorder. I didn't really know. So every time the winter would come, it'd also be wrestling season. It was miserable. I wanted to play football again. I also wanted to go to medical school down in North Carolina, yada, yada, yada. Basically, I put in my transfer papers because I wanted to go to UNC and wrestle and play football for them. When I went there, I did both. Realized I wasn't Bo Jackson. It was tough. Like, I don't know, when you're young, you think you can do everything. I was like, I'm going to go to medical school. I'm going to be an All-American wrestler. I'm going to be an All-American football player, blah, 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 blah. You start, when you guys look at seasons and how you have to have an off-season. I didn't have an off-season, and it was taking a toll. So I'd go from football to then wrestling and then to football without any off-season. I was like, my body, I was getting weaker and weaker.
Yeah, I know some people who did football and track, but they're sprinters, a couple throwers. And even the guys who could throw and play football successfully were freaks of nature, like a Joe Thomas type of person. And the sprinters, it's like, they just kind of came out for a speed workout. But something that's so, not that there's not a lot of transfer between football and wrestling, but they're very much their own things, especially at that level.
Yep. And so, nobody's ever really done it at UNC. So it was one of those things where it was like, I'd go from football season to wrestling and then all of a sudden spring ball. And it was like, I need time to let my body.
Well, you could have been, they had Julius Peppers, Ronald Curry.
Yeah.
Yeah.
It's true. Maybe basketball is.
Yeah. But the body's getting beat up a little bit more in wrestling.
Then again, I'm probably no Julius Peppers.
Very, very few are. Very few are.
So anyway, I ended up just doing wrestling at UNC. Did very well. I got up to like 265 at one point. And the big thing, powerlifting and weight training were my thing. Those are what helped me excel using speed and agility, but also strength to then kind of lift my opponents up and slam them type of thing. My big thing was, though, after that career, I wanted to use what I used to get good at sports to then give it to the general population. Almost like I was obsessed with nutrition and exercise, and I wanted to take just a fraction of that to go, why don't we just give it to the general population, a fraction of that, to then prevent and cure chronic disease. So I was like, I'll go to medical school. Didn't get into UNC, even though I went there and was their heavyweight. But after medical school, went to family medicine, and after family medicine specialized in obesity medicine, and then just recently specialized further, another specialization in lipidology, which is the study of cholesterol, basically, cholesterol medicine. So that was kind of my route.
So then you were practicing, a regular practicing doctor on a day-to-day basis, right?
Yeah.
And now you're a doctor of
in the cloud.
Memology?
Memology, board certified in memology, basically. Yeah. So this is an interesting thing. So, and we can talk about the medical system and how horrible it is. But I was practicing in a clinic, and during my 15-minute lunch break when I do a Facebook Live or Instagram Live, and 100 people show up and asking questions, I felt like I was helping more people during that Facebook Live in my lunch break than I would during my regular clinic day. And then having the administration say, you need to see more people, which means I'd get less time with each person, which means less time to give aggressive lifestyle counseling and everything like that. It wasn't fulfilling. So I got an opportunity to do online doctoring in the cloud, telemedicine, which I took. And then, now I'm working with RP, trying to kind of give more of this chronic lifestyle medicine therapy to everybody, if possible.
So I follow you on Instagram. I see the memes. I'm not 370 anymore, so they don't hit quite as close to home. But as that guy, that red tomato-headed man over there would have been a bit alarmed. Like, I feel like this is really directed at me.
I'm personally attacking.
Yeah. So as you look at obesity in America, what are some the things where the medical system is really doing these people an injustice?
Yeah. So right now we have doctors who don't understand the complexities of obesity. It's more of just put your fork down, shake your head, no, I don't want any more food. Eat less, move more, which we know energy balance is correct. We're not refuting that, but it's more of that these doctors kind of are shaming their patients and they don't have the tools to actually help them. Even if they had the tools and understood everything about obesity and why it's not just eat less, move more, a lot more goes into it. Even if they had the tools, they don't even have enough time to then give to the patient. And then even if they had enough time, insurances don't even reimburse that well for obesity treatment. Like, you can't even put obesity as a diagnosis, as your number one diagnosis, and get reimbursed. You have to put what's called a comorbidity, meaning something from obesity. So I'd have to put prediabetes, hypertension, and then the third one I can put obesity to then even get reimbursed. So there's multiple complex. They don't teach about it in medical school. They don't teach about it in residency. And then further, once you finally get out, and if you want to teach yourself and go do specializations like me, then you won't even get reimbursed for it. So then there are Facebook groups and these groups that figure out how to actually do this, but it's like pulling teeth to actually figure it out. So the system, the training isn't built for.
That's remarkable that it's not like a big piece of medical school with how big of an issue it is.
Yeah. Metaphorically
Yes.
speaking too, yeah. So, and the thing is, so there are a lot of these committees trying to get obesity training into the curriculum of medical schools and residency. So medical school is 4 years, and then you choose a specialty, which it's anywhere from 3 up to like 8 years if you're doing neurosurgery. And then you can specialize and do fellowships, and you can just keep training for the rest of your life, really, if you wanted to. But they need to get it into everything for medical school and further training.
So you've decided to cure this problem with memes.
Yeah, memes. I think so. Yeah, my big thing. So it's funny because I started off doing infographics. So Facebook is where I started. All I would do was share like some clinical cases from my patients. Like, so my patients did a few simple things, and here was their success. And my Facebook blew up. But then Instagram kind of came along, and I was making infographics, but they're a little bit more sterile in that like. It's just information, right? But I grew quickly on Instagram. It was just a couple years ago, and I'm like, this isn't actually my personality. I'm pretty goofy, and I like poking fun and using humor, which some people, again, they don't take it kindly. They don't know my personality, so they just think I'm kind of being this pompous, arrogant doctor, which I understand from an outside perspective. But if they knew me, they'd be like, oh, he's just playing and having fun. But so then I went to the memes. So I'd kind of take something somewhat controversial and poke fun at it, but then in the post they explain it and try to give good information, kind of that infotainment type of thing. So, but people really take to it, and I, based on the transition, I get a lot more people reaching out that have really appreciated it, because it's, instead of, I can't tell my patients how direct I am in those memes, like, I wouldn't be able to, bedside manner is important. So I wouldn't be able to be like, kind of make fun of them. But if I can do it in like, an indirect...
You cannot has cheeseburger?
Yeah, I cannot has cheeseburger. But in the memes, they laugh and they're like, okay, I understand it. And then they know my personality, where I'm gentle on a bedside manner standpoint, to where it really has helped them go, I understand it is energy balance, and I understand that doesn't mean it's easy, but it does mean that we need to figure this out and strategize to figure this out. So it's worked very well. Some people don't like me because of it, though.
Yeah. So as these topics of like fat shaming and is obesity a disease,
right,
and this kind of stuff, give me some of your insights in those.
So just from a pure scientific pathophysiologic definition, obesity is a disease, and it's based on this certain criteria. So then people will say, but it's a choice. Whether it's a choice or not doesn't matter whether it's a disease. You could say type 2 diabetes is mostly a lifestyle choice. Cardiovascular diseases, mostly based on lifestyle choices, but that doesn't mean they're not diseases. You could smoke and get lung cancer. Does that mean that's not a disease? You could get emphysema, COPD. Are those not diseases because you chose to smoke? And of course, then people say, but it's an addiction. You could say, well, then people may have some kind of more propensity to eat. Yeah. So we could go, and then they're like, well, you'll see all the different arguments about it, and you come back and be like, it doesn't matter whether it's a disease or a condition. It's hard to beat. It's hard to defend. We need to have all our tools to go against it. So that's my stance. I mean, it's not even just my stance. Now it's kind of the paradigm shift in the medical community. And it's taken a long time, because most doctors still think that, like, put the fork down. But they don't say that to necessarily people with cardiovascular disease or the things that obesity may have caused. So the reason we want to hit it earlier is because if we can then beat it earlier, we don't get those end stage diseases from the original disease or condition, if you want to say. So then with fat shaming, though, the thing is, we get these healthy at every size movement, where some people kind of push that it's like, nope, obesity doesn't matter and doesn't cause health issues. Well, we know that's not true, but I think the good part of that is more like, hey, just be comfortable in the body. Like, it is hard to lose weight and keep it off. It's hard. And some people may never do it despite their best efforts. So be comfortable and love your body for what it is, no matter what, and then try your best. So I think that's a good part of it. The bad place is where then, this fitness professionals will then go, no matter what, if you have obesity, or they'll say, if you're obese. I say if you have obesity, because we try to separate the person from the condition. We call it person first language. sounds stupid because it's like, has obesity? No, you're obese. No, we try to separate it. So the fitness professionals will say, no, if you have obesity, you're going to die earlier regardless. And it's like, well, that's not necessarily true for everybody, number one. Number two, that's not necessarily helping anybody, because people can live long lives with obesity, and some people will never be able to resolve their obesity no matter what. So we have to just understand where everybody's coming from and fit these two ideas together. Like, yes, obesity can increase your risk of certain conditions, pathologies. Yes, it's hard to actually lose weight and keep it off and resolve the obesity. Yes, everybody should love their own body and be comfortable regardless. So a more nuanced approach is basically what I push.
Yeah, certainly a difference between like, I love my own body and so I don't have to change anything,
right,
versus I love my own body and I want to, I mean, I guess it's a semantics language, so much of it's up a language that like, to even say like improve it is,
yeah, because
offend some, but
so what you'll see is that some of these people with obesity will be like, it doesn't matter, I can be whatever weight and I'll be healthy. And then you see the fit pros going, no, you're going to die earlier than everybody else. It's like, whoa, wait a second. Like, can we just not be mean to each other? But let's be reasonable. Yes, obesity will increase your risk of certain diseases. That's not debatable. There can be people that are metabolically healthy with obesity, and that's seen. But then some people with obesity will never be able to lose the weight. So for some people, hey, let's just get them to do the best they can. For other people that will be able to lose it, let's help them out. Let's not shame anybody with obesity that they're going to die early. So that's really more of where I come from. And it's more of a scientific, nuanced approach. And that's how I think most people should be, because otherwise it doesn't help to shame people. It also doesn't help to just say it doesn't matter either, I think.
Yeah. So if we make Spencer Nadolsky the Surgeon General, is that the highest? That's the boss of all medicine?
Yeah.
Okay, so we make you the Surgeon General, and you're going to create some reform within the medical system about how doctors are educated.
Yeah.
If you had pick one thing above everything else, what's your first move?
Yeah, if I could somehow make sure every medical school is aggressive about understanding the underlying lifestyle and adipocentric, if you want to say, cause of disease, I would make sure that every little block, every unit of biochemistry, every pathophys, every class would have that underlying. So let's make sure from a medical standpoint, we're helping our patients. The thing is, I only think that will go so far. I think further than just the medical, public health is important. So somehow, I don't know how we're going to change the environment. Does it come down to legislation and we don't want Big Brother handling our food? But maybe there's something there. I don't know. But like, imagine we didn't have this issue, years ago, because we weren't surrounded by this obesogenic environment. And people will say, yeah, well, maybe it's something in our genetics. Well, yeah, our genetics kind of load the gun, and then the environment pulls the trigger is what the quote is. So probably something to do with having to fix the environment. Legislation, I know a lot of people wouldn't like to hear that, but I don't know what else to do other than we just start from scratch and put everybody on an island, and we have only fresh food that's available and not these processed foods that we overeat unless we think strongly about our choice. So.
And how much, in you saying that, how much did Monsanto just cut your...
I know. There goes my check. Those big golf tournament sized checks.
Yes,
isn't gonna show up at my door.
Yeah, the briefcases that shady big food reps bring to you every week.
My monocle and my bag of money with the money symbol on it.
So if you're with the other group kind of prevalent in this, the Fit Pro side of things, I'm sure there's some Fit Pros or registered dietitians or whoever are saying that doctors don't get enough education about nutrition, and you have to be even so much more the other side of things, like, well, you took an 8-hour personal trainer certification and you're trying to teach people how to not be obese.
Yeah.
What if you could just yell at all those people collectively.
So I've made some very passive-aggressive, sarcastic memes about that. I'll go, doctors, quote, doctors don't know anything about nutrition, says person that had no education on anything whatsoever other than a weekend certification. So like, I think step back and go, look, I think doctors should know more about nutrition. We learned a little bit, but like I went out of my way. I mean, since I was in college, I've taken courses, I've done lots of reading, extracurricular reading. So I do think doctors should know more, but at the same time, there becomes a point where doctors can't know everything about everything.
Yeah.
So I think it should be more pushed that doctors should be more aggressive about it, and then given a system to where they can flourish and know how, and then have a way to refer to people that do know more. Because like, we shouldn't know more than dietitians. We just shouldn't. If you want to learn on your own, whatever, fine. But like dietitians or some other healthcare provider that's nutrition focused, they should be the experts, and they should all be within a multidisciplinary team, because the doctor can't do everything. That's why we have nurses and medical assistants and administration and social workers and physical therapists and all these people. So it's everywhere. We shouldn't be pointing the fingers at everybody. And I do think doctors need to take their ego back a little bit and say and admit that you don't know everything. I don't know everything about everything. I think we should have open minds, but then I don't think people should then have the expectation that doctors know everything either. So everybody needs to take a chill pill a little bit.
Yeah, I mean, I've certainly had my own frustrations with doctors and nutrition stuff.
Yeah.
I mean, I didn't have insurance for like 10 years, so until this year was my first year with insurance.
Wow.
So not for my own purposes, but my dad is very sick, and he was just losing weight. And it must have been for like 2 years. I'm like asking my mom, like, well, did they have him track like what he was eating? Because my whole life he was 195 to 205, and now he's like 145, 150.
Unintentionally.
Very unintentionally.
Okay.
And they're saying, he needs to go gluten-free, he needs to do this and that. And I'm like, did they figure out how many calories he's eating? Because like, of all the things in my life that I know how to do well, gaining weight is like really high on the list.
That's your specialty.
Yeah. And I was like, yeah, this is 2, 3, 4 different doctors. Like, none of them had them actually like track, like create a food log and see how much.
What are you doing?
Yeah. So,
did they ever get to the bottom of it?
I mean, some of it is, I think, linked to his disease. He's got a Lewy body dementia.
Oh, okay.
And I guess weight loss is pretty typical with that.
Okay.
But it's been a frustrating thing for sure.
That is rough.
So, big shift. Steroids.
Steroids.
So, yeah.
Steroids.
Yeah. People love them. They're awesome. Agreed?
I got tested all through NCAA, and the thing is, so I gained a lot of weight. I mean, I ate pizzas and things like that, and just worked out like a madman. So I have a lot of patients who use steroids, and I try to stay as judgment free as possible. And the way they describe it is basically, you feel amazing, and that you recover so fast that you would never want to stop because you just feel like Superman. That's what they describe.
So, having lived in the world of untested powerlifting for the last 8, 9 years, I think that there's 3 levels of steroid use in strength sport.
Okay.
That there is there's none. There's truly drug-free athletes, and to the people who are saying like, oh, all the IPF lifters, all the weightlifters are all on steroids, like, and beating a drug test is just an IQ test. Like, it's fucking bullshit. If you know, okay, I'm going to get tested on this day, sure, that's easy to beat, but out of competition, all that stuff.
Right.
If you don't have an entire government, a la Russia and Icarus and stuff, helping you, it's hard to beat them.
Okay.
On a Balco. Then there's, among steroid users, there's like, okay, I have some sense about me. And then, which we get a lot in the world of untested powerlifting, like, I just don't give a fuck. How much can I put in me wherever it's not sore, I'm sticking
Yeah.
sticking the needle in. And I've seen all these.
You've seen the spectrum. Huh?
Yes. So if you were to give advice to a, mature adult who, upon their own fruition, is going to decide to use performance-enhancing drugs, what would be some pieces of advice that you would have them? Also, they're doing this in untested competition. They're not cheating
Right.
the rules of sport.
So basically, when someone comes to me, because I get a lot of patients that come to me because I'm kind of in this world of helping athletes, and I was an athlete myself, and they want to excel. Maybe they didn't do much when they were younger, and they're just like, you know what? Everybody else is doing it. I want to get big and strong and look a certain way. I give them the benefits and the risk. I say, look, I can monitor you for certain risks. If you get like a dyslipidemia, like your cholesterol numbers change, I can help you with that. If your blood gets too thick, your hematocrit goes too high, we can monitor that. You can understand the risks and the benefits, because like it would be the same thing as when a doctor knows that a patient says, I'm using cocaine or heroin or whatever drug, and you don't, if you scold them, they're not going to come back to you, and then they're just going to do it on their own. So when patients come to me and say that, I'm like, look, just so you know, it's for longevity purposes, it's probably not the best thing to do. But if you're going to do it,
then they tell you, fuck longevity. I'm going to have the hugest casket ever, bro.
Yeah.
Has anyone said that to you?
well, so it's kind of in so many types, in so many words. They're like, yeah, I don't really care. I just want to get jacked and tan. I'm like, okay, whatever. I'll watch you. And what basically I say is like, look, I'm not a steroid guru, but if you know someone that's used that, like understands the pharmacology, and obviously they're probably not a physician, although there are some physicians that actually do prescribe these. I don't know.
That's a niche.
Yeah, there's a niche there, but and they give, and I'll monitor your blood. And you get a blood pressure cuff, so you check your blood pressure. If you need blood pressure medicine, I can give it to you. I'll monitor your blood count, all these different things. I just tell them the benefits and risk. I document it, and I think there are a lot of doctors out there that kind of wag their fingers, and then these people go out by themselves and don't even get monitored, and then you see things like strokes and whatever, because, hey, look, they could have prevented this by making sure their hematocrit didn't get too high, or they could have, hey, probably should back off a little bit on this and that. So yeah, I'm more of like non-judgment. I'm not going to facilitate it, but I will monitor and make sure you do it safely if you're going to do it.
How about for like TRT for like legitimate prescription purposes?
Yeah.
Is that something that you think is really going to benefit a lot of men?
So I actually do TRT for a lot of former anabolic users, because and some of them won't admit until later, like, you know what, I probably abused it. But most people are pretty frank with me, because I just tell them, like, look, either you got hit in the head, or you had mumps when you were younger, or there usually, and there's some aging things that can occur, but aging is, as long as you have a good lifestyle and age well, hypogonadism is not usually a thing. But it's usually people that messed around with anabolics when younger, and their access between their brain and their testicles isn't working as well. I'm like, look, probably quality of life is going to be improved, and this may actually help you live just as long of life, but with a better quality. And so I do that often. And sometimes we go through other protocols. I'll give them HCG and Clomid and all sorts of other stuff to try to restart it, which actually does work very well in certain cases. So yeah, I go through everything with them.
What kind of upcoming projects you're working on? What's new for you?
Yeah, so right now I'm working with Renaissance Periodization, trying to get them and their dieting out to like more of the general population as opposed to just the athletes, which is going fantastically. They got their new app. We're doing some really cool things with the app, and then their coaching, really just trying to spread it across the world, as opposed to just hammering the physique or CrossFit or weightlifting athletes. And then, of course, I have my own online clinic, which is I'm pretty much booked up. I can't really take any more people with that. And then I am studying, I'm taking some classes in statistics and stuff. I want to do some research into the metabolically healthy obesity and some of that. So kind of taking some of that research and bringing it to real world and real world to research, because I think that there's a gap in between there.
And then are you going to get back on the jiu-jitsu mats at all?
Yeah, so I was just telling you before the podcast, but I probably, if I'm going to get back on, it's going to be no gi. And probably takedowns. I don't think I can, so wrestling in college, the grappling on the mat is just, it's the difference between speaking English and speaking, I don't want to say Greek, but it's completely different. Maybe the difference between English and Spanish, it might be more though, more so. Maybe Russian. So, but anyway, yeah, I got in an arm bar, and I didn't know what was going on, and I was like, what are you doing? I flexed out and tore my biceps, and it's like, I got 2 kids I got to hold at home, and I was like, I had to go through surgery. Luckily, I recovered faster than most anybody does through the recovery process, and now I'm lifting like I was. So, but I think I'd probably just stick to takedowns and no gi, so nobody can grab me. Like, I'm not used to that in wrestling, where you have a singlet and spandex.
Yeah, wrestlers. I played football and did track, and then did track in college. And we didn't have wrestling at Berkeley, and hadn't been around a lot of like wrestling culture until more recently with working with Coach Jacob Harmon. Wrestlers are insane.
Yeah,
they're insane people.
Yeah,
like the fucking hardest working, just grinders of a sport I could imagine.
Yeah, it was tough, and so yeah, it was trying to do. That's why I admire you doing the jiu-jitsu and still working out, because like I started doing it again, and it was like, holy cow, my body's sore. I wasn't recovered. Like, I'm used to going for running and biking and not wrestle. I hadn't wrestled in a while, other than once in a while I'd go back and wrestle, high schoolers or college guys, just for short little bouts. But being on the mat for jiu-jitsu, I was at Atos in San Diego, and it was like the next day I was like, oh my gosh, my body is so sore. And the thing is, it was really fun until I tore my biceps. I'm like, well, that's not fun. I don't need to do this. What am I doing? But yeah, I think I'll probably get the no gi on and probably do some takedowns, because I can do that. Unless somebody gets a good shot in. I don't know. Probably not though.
Yeah.
I think I'd be fine.
Nice, man. Spencer, nice meeting you.
Yeah, thanks for having me.
Thank you. Thanks for coming up. Thanks for watching that episode with Dr. Spencer Nadolsky. Make sure to go follow him on Instagram at Dr. Nadolsky. You can learn more about him through the Renaissance Periodization website, renaissanceperiodization.com, and subscribe to the podcast, share it with your friends. You can find us on YouTube, iTunes, Spotify, Stitcher, iHeartRadio, and at jtsstrength.com.